I am trying my best not to say you don't realize how much you do that until you listen back to yourself, and oh my goodness. So I'm really working on that. But what I want to say first of all is thank you. My name is Tammy Jones. I am at the edge of Oklahoma and Arkansas. And my family has been affiliated with the Oklahoma chapter now going on 4 years, I believe it is. We are ready to get back in person, as I'm sure everyone is. But we look forward to, even though having virtual, that has been great. It's been a good connect. So welcome. I'm hopefully some more will be able to jump on, but if not, you know what? I'm happy with anyone that we can connect with. So in a minute, we're going to go around. I'm going to let you introduce yourselves. It has been a while. I'm going to start. I've introduced myself, and then I'm going to start with Tamra. She is the new NORD ambassador for the state of Oklahoma. So you're going to hear a little bit as I share with you tonight about the NORD and how they're connected with bleeding disorders. And some of you may already know. If you do, I'm excited about that. For some of you that have not known or do not know, we are part of a rare bleeding disorder. I just discovered that in the last year, which was definitely an eye-opener for me after being treated for so many years and never hearing that come across. So at this point, I'm gonna skip over to Tamra, and she's going to introduce herself and tell you, just take a couple of minutes to tell you who she is and what she is going to be helping us do in the state of Oklahoma.
Okay. Thank you for inviting me today, and I'm sorry I did wear red today. It was on accident, but I'm so glad I did.
All good.
I have no makeup on. I am in the middle of getting ready to take a bunch of kids down to Falls Creek for camp, so excuse me for looking the way I do. So anyway, but thank you for having me. I am the state ambassador for Oklahoma for the Rare Action Network for NORD, for the National Organization for Rare Disorders. And I work alongside Tammy in Arkansas. We're so glad that we cross over with Arkansas so much. But we work with, Tammy's going to tell you all this, but mainly I want to work with you all in Oklahoma and Arkansas to advocate for you all and me. I'm a rare disease patient. This is my son. And we work to together with you, with the legislative body in the state and on the national level to affect change, to help us and other rare disease patients, caregivers, to make our lives better. Is that a good way to say it, Tammy? And if not for ourselves, but for those that come after us.
Exactly.
To make lives just a little bit better and easier. We work with the legislative body. That's what we want to do. I want to work alongside you to make. If there's anything that I can do, I'll leave my contact information in the chat box. Please reach out to me. Join the Oklahoma RAN. I'll leave all that information for you. If you haven't joined the Oklahoma RAN, please do so. And also our Facebook page has a wealth of information, and we're going to be doing a lot of crossover events. And I'll be working with Tammy and everybody else within your organization. We are working to build out the RDAC in Oklahoma. So we'll be getting all of that, we're gearing up for that, hopefully get that enacted in the next couple of years in Oklahoma. So thank you so much. I'm here tonight to learn also, so I'll be listening a lot.
Thank you, Tamra. Kristen, why don't you introduce yourself and tell us kind of where you fit into our VWD family?
I'm Kristen Boyles. This is my husband, Derek. We are both type 1 VWD, and our 12-year-old will be running through here pretty soon, but he is our type 3. I'm on the board for OHF, and we've been involved with OHF since Kim was probably 1 or 2. So
Oh, thank you. Terry, I see your
Yes,
name popping up next. How are
I'm
you?
here. Good, good.
So tell us a little bit about you and your connection with VWD.
Well, my son is, he has factor 8, not the other, but anyway,
It's okay. We're bleeding disorders.
yeah. And so, that's my connection.
Okay.
So,
Jeanette, that must be you that I see at the Oklahoma hemophilia. Why don't you kind of say hi and just let everybody know that you're here and plugged in with us.
Yes. Hi, I help our executive director with whatever he tells me to do. And that's fun for me. I don't have von Willebrand's disease. I have a rarer type of bleeding disorder, but I represent those that serve you in this space. And so, of course, if you ever need anything, myself or the executive director, Tim Grogan, will be at your service. We are here for you.
Thank you. Miranda.
Hi, I'm Miranda. I have hemophilia A mild, and then my son's dad has von Willebrand's type 1, and Theodore wound up with severe hemophilia, and he has von Willebrand's type 1.
Bless him. Hi, Glenn. Would you like to tell us how you fit into our group tonight?
Glenn, I'm going to help you out by unmuting you.
Okay.
If I can.
There you go.
Okay, wonderful.
All right. I don't have von Willebrand's disease, but I do have a bleeding disorder. I do not understand most of what the doctors talk about from time to time. And I just feel that the more education you can get, the better off you are.
Way to go.
Amen.
I'm glad we're connecting, Glenn. Do you know what your bleeding disorder is?
It's dysfunctional platelets.
So do you have ITP?
No, ma'am.
Okay.
When I cut my finger or whatever,
Uh-huh.
it takes it forever to quit bleeding. And when I have to have some little minor surgery, I got to have an infusion before and an infusion after. And they pulled the medicine, which was Steinmate, that I was taking on a monthly basis, and pulled it off the market. And as far as I'm aware of, not replaced it at all. And anyhow.
You are correct, Glenn. It appears 2 of us also was using Stymate, was working for us, and we lost that too. Right now, they're looking at 2023. Because there's nothing to replace Stymate as such in that, we had to go to a factor infused. So that works for us. So that being said, that's kind of what we're looking at. I'm going to touch on that just a little bit as I go through. I know some of you I don't know very well, but what I want to do tonight is I want to share just a little bit of my story, and then I want to talk to you a little bit about advocacy roles. We're going to just kind of do some jump starts tonight, and then I'm going to let you know what are going to be looking for on our next call. I know that we were doing our calls monthly. That became a challenge because, well, first of all, you know, in my case, I've got my bleeding disorder family, I've got my rare family, I've got a mom that I am a POA for. So I also have a diabetic that, so I'm a caretaker, wear a lot of caretaker hats. So that being said, I know that the challenge it can be to constantly have calls. We want that connect. So what we've decided is we're going to be doing about every 2 months. the next date, if you guys, we will try to remember to say this again. The next date that we're going to be looking at is July the 27th. Here's my calendar. July the 27th. And I really want to encourage you all to join us and invite someone to come with you. If everything holds as it is, we are going to have Dr. Liz, who is a practitioner, nurse practitioner, physician assistant that is an OB-GYN. And I met her last year when I was sent to her for a hormone replacement for myself and my age. And wow, did I find out some great things. So let me tell you just a tiny bit. And then I'm going to want to hear from any of you in a little bit about if you've heard about some of these things I'm going to talk about and share with you, or if we are just still building on those. But when I was sent to see her, my daughter went to her first, and of course she knew, we definitely talked about our bleeding disorder. We were just absolutely astounded. And when she told us that, she said, we're part of the program where, if we have patients that come in and are having bleeding issues, then, we ask them questions and we do some discovery. So they are part of the programming that actually has been talked about over the last couple of years, where this is going to be coming in to our ERs, into our OB-GYN offices. So we're not all going to walk in now to every doctor. It's going to take some time to get this around, but we're not going to be walking into every doctor's office and them looking at us like, what do you, VWD? I don't know. I heard this much when I was in medical college. So they are actually taking this, and it's because of our advocacy. I'm just going to tell you, the bleeding disorder family, we are strong advocates because we don't have a choice not to be. So many other places, we have some great advocates. The other thing that I kept hearing several times as we were introducing everyone, that, well, how do I say this? They kept saying, well, I don't have VWD. I don't, I have this or that. So please let me clarify my heart and my thoughts on this. We are bleeders. No matter what bleeding disorder we have, whether it's VWD, hemophilia, whether it's another rare bleeding disorder, we bleed. The differences come when we discover what medication works best for our bleeding and how often we need to use it. So we are a family of bleeders, no matter what the title is, we all bleed. And so we're all in this together. We're all working together to try and make things better, to bring more awareness, to there again, educate our doctors, our OB-GYNs. I mean, I went through the phase where my OB-GYN didn't pick up on my bleeding disorder, and I actually had two of them, one in Conway and one in Fort Smith. And so we actually taught him about that. And as he went to further take care of my daughters, when it got that time for them, then he was educated about it. This was a very brilliant doctor from England. And I can't tell you, I look now, learning all the things that I've learned, and go, wow, that really surprises me. So there are some steps being made so that when bleeding issues come up at a visit, whether it's a PCP, some of our PCPs, ER, OB-GYNs, and our other doctors, they are asking more questions. They are getting a checklist and saying, how often do you bleed, and different things, bruising. And through that, that's when they're starting to look at, does this patient need to be tested? Okay, with bleeding disorder patients, we know that doesn't happen real often. So we are making an impact. I am from a family of 5. I have 5 family members, myself included, that have VWD. We traced it back to my maternal great grandmother, who then called it Christmas disease or a free bleeder. So that being said, that's what I know. Just sharing that with you, I want to say that a lot of the people that I have met at conferences over the years, when we get to be our age, we think, oh, it's no big deal. We don't need to be tested. You know, I mean, hey, we're way past that. We're not having all the bleeds and stuff that we used to have. Well, it is vital, because we need to know, since this is something that is passed from generation to, I mean, it just is passed in families and from generation to generation. It's very important for good care, even with the gene therapy, for us to know how far back this goes. So it is very important for those grandparents, if they haven't been tested, to be tested. I encourage that. Now, listen, these are my thoughts. You have all the rights to your thoughts, but I know in the lives that I have been able to connect with, it has been very important and very vital, because sometimes if it skips that generation, then wow, all of a sudden you get hit with it again. Okay, so let me tell you a little bit about my t-shirt tonight. I'm going to pull my, there you go. It says bruised, not broken, type 1 BWD. And I wear this shirt, and when I wear this shirt, it is definitely a conversation piece. They want to go, what do you mean? And that opens a door for me to share. I can't tell you how many times we've connected with someone because of these shirts. So I wore this shirt tonight because there again, we are bruised, not broken. We are not totally broken, because we are advocating for the care we need and the care that our families need and our friends and all those that come in contact with us. Before I go on, let me just ask, any of you, feel free to answer. Have you heard do you have anyone in your area that you've heard in the doctor's offices or ERs that are actually working with the VWD program or bleeding disorders if you come in with bleeding issues? So what are you hearing in Oklahoma? Do any of you have any feedback for me on that?
I have some feedback on that.
Okay.
The ER, one day Theo was playing and he ran into a door frame, and I contacted HTC, and they said to take your factor to the closest ER. And I called up the ER, and they said that they don't have that, and that my best bet would go to Oklahoma City, and they wouldn't even go further from there.
Well, let me tell you, Miranda, there is some help. Thank you for that input, because it's our job. You know, Tamara and I are both volunteer ambassadors for our state with NORD, which is another national organization that also falls in the umbrella of rare bleeding disorders. So the vitality of that is that we are making a way to have that worked on. Arkansas and Oklahoma, I believe, is going to be working on the emergency protocols. That's with Danny's Dose. Some of you probably have heard of Danny's Dose. I also serve on their board. But we were able to pass the emergency protocols this year in Arkansas just for that reason alone, so that we will have, so if there's an emergency situation in the ER, if we have to call 911, go to the ER, or any place like that we're seeing, we're not going to continue to be told no once we get this activated, because our doctors, there's going to be a letter that's going to let the EMTs and all the emergency teams know what we need, and that they will be covered and still be able to give us medication. Now, it's medication, there's a lot of disorders that have very exclusive, expensive medications. We know in the bleeding disorder community, it is huge. It's the same way in so many other communities. So that's what this bill is going to do for the state of Arkansas. So we are working actually to try to get that in all states. with Danny's dose. We're also working on it on a national level. Well, as we know, brakes kind of got screeched with COVID hitting us, but we're not giving up. We are going to continue to try to push legislators to take this in, and hours passed without any problems whatsoever. This was my first year to really work a lot with legislators. So that is going to be something that Oklahoma is going to be working on. And I know that because I'm on the board. We want every state to have that, so that when you call, Miranda, you don't have someone say, we can't do that. We don't have that, because you're going to have your baby's medicine, and they're going to have the coverage that they're going to need from his doctor to be able to give him his medication. And so that in itself is huge for so many patients that are seen and that need to be seen. Anybody else have a comment on that in your area?
I just wanted to piggyback on what you're talking about with access to medication. With our recent advocacy days, we were able to meet with some of our rural legislators from Miranda's particular area, and also Terry from the Florida County area. So we basically reminded them that if we have to take our healthcare business needs to another city, that means that those dollars don't go into their local hospitals. And so that seemed to pique everyone's interest. So just to say again how important advocacy is when you have a bleeding disorder like von Willebrand's disease.
Exactly. Thank you. So moving on to, I'm going to chop up my story in little pieces here as we go through tonight. But I was diagnosed in my mid-30s after I'd already given birth to 4 children. I had grown up my life bruising very badly, to the point of thinking, if a bruise looks that bad, then I should remember bumping myself. But I could just barely bump, and I would have this enormous bruise. All my life, I grew up with that. Had very heavy menstrual cycles, started when I was 8.5 years old. And of course, you can imagine that many years ago, that was not a tab. That was kind of like a taboo subject. You didn't discuss that. You didn't talk that around the table. Thank goodness that we can have a little better connection with that now. That being said, it was, of course, just told I was normal. And I went through, like I said, the birth of 4 children. And of course, we know that when we are with a bleeding disorder, when we are pregnant, our hormone levels are up some. And so therefore, it helps with the bleeding, because one of the things that we use to help slow the bleeding or stop some of the bleeding is hormone replacement. So when our hormone levels are higher, then of course I didn't bleed as bad. But then after my babies were born, it was a totally different story. I would not stop bleeding. The whole 6 weeks, I never stopped bleeding. I just kept on. And then of course, after I continued to have my babies and I finished up with number 4, I wasn't real sure that I was done, but I wasn't sure that I wasn't. And the bleeding got so intense, and the bruising and the nosebleeds and just the exhaustion, which of course I'm being told all this time that's normal. I even had one of my doctors, and he was a great doctor. So it's just the ignorance of them not having the awareness of bleeding disorders. So, we want to think that it's not altogether that the doctors are bad. It's that they're just ignorant to our bleeding disorders, and they need to have that awareness brought to them. And he was great. And he said, "Oh, girl, you just keep having babies and you'll be fine with that." Well, I did have to quit having babies, and I had a very, very hard time. Whenever the second year I went back, and I just, it was so severe. I couldn't leave home. Nothing was helping. And all this time I'm still being told that's normal. Well, in my mind, it couldn't be normal, but I didn't have another reason to tell me that it was or wasn't. So that being said, that timing is what drove me into, or led me into, advocacy work, because I was very distraught that I had VWD, I had a bleeding disorder, that I was a carrier of a bleeding disorder, and I had passed that and would be passing that on to my children and my grandchildren and great-grandchildren. That's a lot to swallow. And I know those of you that are dealing with a bleeding disorder know exactly kind of what I'm talking about there. So in that, I decided, okay, I was given the opportunity to come, and actually the women's bleeding disorder, or the women's conference that they had in Texas, is how we started learning about this. So at that, when we started going there, and we just kind of talked about this the other night over the weekend on the teen camp retreat, what that Oklahoma had, that is now going to dissolve because it's hard to find that leadership. But that being said, I was given that opportunity to come in a little early, and my daughters and I went and took a class on how to advocate in your community. So that in itself was kind of the jump start. I'm like, okay, fine. Nobody else is going to suffer the way I did. All the unanswered questions. And that's where I was able to kind of pull out of that dark depression of, wow, look, I've passed this on. Not that I could help it, but that's just where we were. So I started into advocacy, and wow, it was definitely became a passion for me early on, very quick on. That being said, some of the things that I did was I came home and immediately started in my community and with our emergency teams, because we had some great guys and that worked here at our EMT station that have helped us. We've been in our city now for about 31 years. And so they helped us. They helped infuse us. They were amazing. We were able to teach them about our bleeding disorder. That helped, and it started there. And then we started going to, when they would have their renewals, about every 3 to 6 months, they have to go and get updated. I'm not sure if anybody got a word for me. They had to have their
Recertified?
recertification. Thank you. Recertifications. There's the word. So I called, and we were able to talk to the director, and we were actually able to go and share about our bleeding disorder with them and talk to them about it. And there was one point we have reached altogether 8 counties in the state of Arkansas. It was hard because at first it was scary, but guys, it was my story. I couldn't mess it up. It was my daughter's story. She could mess it up. So, we don't cross those lines of medical, speaking on the medical side. So hopefully anything that I've shared with you tonight about my personal story, you're not taking as medical advice. That's my story. That's what happened to me. So as I got more and more into advocacy, then I also touched base with other organizations, and NORD just happened to be one of them. And I was so excited because, oh my goodness, now it's not just bleeding disorders I can help out with. Bleeding disorders, I can help out with diabetes, and I can help out with all these other things. Then last December, I was on a conference, and a screen popped up, and it talked about rare bleeding disorders, and VWD was the first one on the list. Like I said earlier, that much to my surprise, I never imagined. My best understanding is that's because there are so many undiagnosed bleeding disorder patients, especially when it comes to the VWD part. So many undiagnosed. And so therefore, that brings us underneath that 200,000 that is stated that we're still rare. So what we're doing, just coming together right now as a bleeding disorder community and learning together and bringing that awareness, then that's how things are going to get better for us. That's how the ones that are being diagnosed, more being diagnosed, and that's a negative positive. But if you remember back, it was almost a relief when you finally got an answer. The hard part is having all these symptoms and having all these things happen to you, but you don't have the answers. And sometimes whether you're rare or not, and I say this a lot when I speak on behalf of NORD, is that when you have a chronic illness, at some point in your life, you're probably going to feel rare because there's just no answers. The simplest thing changes when you go to the doctor in your blood work or in an exam, and then all of a sudden it's like, wow. So I'm going to share with you just 7 principles of effective advocacy. But first I want to say, how many of you would say to me, Kristen, I know you're probably going to fit in this category. How many of you would say that you're an advocate for your bleeding disorder?
No, we for sure are. I mean, one of the things with the ER is when he was young and we were going through it, we would go and talk to our local ER and take our medication and show him all of that. But we were lucky. We learned very early to self-infuse. Sorry, my dog's going to bark.
That's okay.
We learned very early on to self-infuse. So that's what saved us from a lot of trips. And we infused in a port, and then he decided to move to veins. So, and then part of his IEP at school was if an accident happened and he had to be transported, we also let the EMS know that, not to stop at Wagner Hospital because they don't have medication. So they sent him straight on to Tulsa because we knew we didn't have it here, or we have it on hand all the time. So.
And Kristen, that's absolutely so profound for you to say. And I love the fact that you brought out the IEP. Those are programs in school, within our school system. And most of the time, we're not just told about those. It's something we find out, and then we have to go and ask about it. We actually have one for our diabetic and for our bleeding disorder patient. My granddaughter does not have, we did finally get another test, and she does not have VWD, and I'm thankful because she is a type 1 diabetic. And we actually have come in contact with someone that was a type 1 diabetic and had VWD, and oh my goodness, I really just can't even fathom. I cannot even fathom what that family goes through. So what about you, Miranda? Do you feel like you're an advocate?
Yeah.
Okay.
I feel like I'm telling everybody what I know.
Okay. And Glenn, what about you?
I wouldn't call myself an advocate. You do what you got to do, and I run into the same problem that the lady in Wagner Hospital does. I just live up north in Pryor and or towards Pryor, but back in, I don't know, it was 4 or 5 months ago, there was a push in Oklahoma to pass something through the state legislature. I don't even remember what that was exactly, but I'm kind of acquainted with several of the representatives, and I did write emails to each one of those representatives asking for their support on giving bill to pass through our local or our county or state legislature. I don't mind doing things like that. I have got a new doctor right now that is coming to Pryor that's doing colonoscopies, and I had a visit with him a couple of days ago, and I think I probably pretty well educated him on a lot of things he didn't know nothing about.
That is great. And so, Glenn, you have just shown us a perfect example of advocating. So many times people will say, oh, I can't do that. I don't know how to do that. But what I'm going to say is, I don't know that I've ever met anyone in the last 5 or 6 years, when all the conferences I've gone to, and whether it be a national level, local level, or state level, that everyone at some point has not advocated, whether it's for themselves or for somewhere else, and you just don't realize it. So there are 3 stages of advocacy. One is individual advocacy. All right. This includes services that seek to represent the rights and interests of people with mental illness on a one-on-one basis, addressing discrimination, abuse, and neglect. Now, these are definitions that I pulled out, of course, of the dictionary. Then there's systems advocacy. It's an effort to change policies, which is exactly what we've been talking about here tonight. Rules or laws which determine how services are provided. It's changing the system. And that's exactly what we're doing. We are wanting to make things better for all of our patients. Then the next one, the third role of advocacy is to offer independent support to those who feel they are not being heard, and to ensure that they are taken seriously and have their rights respected. Every one of us, whether we are a patient, a bleeding disorder, a rare disorder, we all want to feel respected, like we're being listened to. That's just vital for our lives. And when we're not, it really can take a big toll on us. So here are 7 principles of effective advocacy I'm going to share with you. Principle 1 is change your attitude. Principle 2 is know your rights. Principle 3 is know the system. Principle 4 is practice kindness and forgiveness. Principle 5, don't be discouraged, intimidated, or afraid. Principle 6, accept and expect accountability. That one's huge. And number 7 is do your best today. Sometimes our advocacy role is different every day. I mean, as I shared with you earlier, I wear 7 or 8 different hats when it comes to my advocacy. And wearing those different hats, sometimes I have to be different. I have to, or my mentality, I have to, really think about it. I have to say, okay, did I show respect? Because when we don't show respect, we can't expect that to be shown back. However, I don't call myself getting ugly. I don't call myself getting rude. I get affirmed. Whenever I get affirmed, let's just say that they know that I'm very serious and they're not going to be able to just, as we would say, push you around. So we want to get affirmed. And to be able to do that is exactly, knowledge is power is one of the things that I say and practice in my life. The more knowledge we can get, the more powerful we feel like we become, because we're educated. We know it's not such a surprise or a shock to us. Everyone with a bleeding disorder, because that's what our main focus here is tonight, every one of us are different in how we bleed. We may be all typed the same. All of us are typed for type 1 moderate. I have one that bleeds more like a type 3. Actually, I guess 2 that bleeds more like a type 3. So therefore, we're constantly having to, look at new things. And the hard part comes is when our doctors, whether it's HTC doctors or whether it's just our hematologists or doctors, they want to put us all in the same category and say, well, you all have VWD type 1, and that's, it's kind of a mild form. Then my comeback on that is talk to my 5 family members, because we all bleed different. And some have had a horrible time, even to the point of saying, well, I don't think you ever had it. And guys, you and ladies, you know what that means. Whenever they look at you after, we had that happen to us after 17 years. Well, that definitely threw mine into a tailspin, because it's like, what do you mean? You mean you've been treating me for this all these years, and all of a sudden you're telling me I may not even have it? Well, we look back at the numbers, and let me just say that numbers are important, but numbers are not always the answer to treat or not treat a certain way. Now, let me talk to you a little bit about on the Oklahoma page, our sweet Jeanette has put on there a recording, a video. It is almost an hour long, and it is Dr. David Willebrand and Dr. Robert Sidonio. I don't know if y'all know either one of them. I don't really know Dr. David, but Dr. Robert Sidonio, I have actually heard speak and in several conferences with NHF, HFA, even just at some other conferences. But I just want to tell you that this is a man that has a passion for VWD patients and bleeding disorder patients, because, for so long, VWD was kind of felt like the stepchild. but we're not there anymore, guys. We have gotten all these organizations behind us, and we have done our part, and it's getting better, and our treatment's getting better. So what this video is going to show you is the new things that they're coming up with about BWD, about typing. Prophylaxis is now going to be an option. I mean, with two of my girls, if we would have had that option, or if we could have gotten our doctor to listen to us and had that option, they would not have struggled and suffered as long as they have. So there's some great things that you're going to want to hear in this video. Take your time to watch it. It is on the OHF page, and let's see, I'm trying to,
I'll share it in the chat, Tammy. Is that what you're trying to do?
great, great. So, and this is something that NORD did. We were able to sit in as NORD ambassadors on this back in January, early January. And this was after I had heard something about this at being part of a virtual HFA conference, and Dr. Sidonio was on there speaking, which is the same time I found out that VWD was considered a rare bleeding disorder. So I sent him a message. He's on Facebook, I just sent him a private message and I said, hey, Dr. Sidonio, what can you tell me? I'm hearing about these new things that are coming across. And he said, hang tight and wait till the first of the year, because there's going to be a lot of new things. And I can't tell you how excited I was for all of our VWD patients to know that, wow. So, typing has always been an issue. They have done some great things and some great studies. And so that is going to be better. Prophylaxis is going to be talked about. It's no longer going to be just for other bleeders. We're going to all in the bleeding disorder family be able to possibly utilize that. So that being said, you will want to watch this. And then it's going to talk about diagnosis, treatment, and the emerging strategies that they have done a lot of work on, and in gene therapy, all these different phases that they have gone to get this information, and they're going to share it. Sometimes the numbers for diagnosing have changed a little bit, and a lot of that is just because of studies that they've been doing, saying, okay, we've got so many problems with typing that we really need to know more. So they're working on it. We can all give ourselves a pat on the back because we're here tonight on this call because we care and we want things to be better for our bleeding disorder patients. That's what gets us into those bills. That's what gets us with legislators. And I'm just going to tell you, legislators are not hard to talk to. And I feel blessed because we have 4 great legislators. I've got 2 senators and 2 House representatives that live right here in the Greenwood area. And they have been amazing in supporting our bleeding disorder, our running red that we do every year as a family, which of course, we haven't been able to do the last 2 years. And hopefully in 2022, we'll be able to do that again. But they have been extremely helpful and supported us in that. And so that just should be something that gives us a lot of energy and say, hey, we are getting our voices heard, but we can't stop. We have to continue to share our voices, to share our stories. We cannot mess up our stories. The first time that I went to Washington Days to go and on the Hill, one of my other daughters was with me. She's the quiet one. And we just kept thinking, oh my goodness, how do we do this? Nervous. And I can remember NHF putting us through the trainings, and we did this several months leading up to it. Tell your story, share your story. No one can mess up your story. So that's what we really started plugging into, is it's our story. We can't mess it up because it happened to us. And I'm telling you, since then, it has just made it so much more comfortable to go in and be able to talk to our legislators and our senators and just make a connection. And boy, I tell you what, last year they heard a lot from me because there were a lot of things that were coming down, and I was constantly sending emails. So I felt very privileged to be able to be a part of that. And we want that for all of our patients. We want it for ourselves, but I'm just going to tell you, whenever you see, I get a lot of emails and connects about new diagnosis, babies being born. And I got a touching story the other day, and the mom tried to tell them, we have bleeding, I have a bleeding disorder. Please do not, be careful where you stick the baby and for drawing. And they just didn't follow her. And this precious baby is just, bless his heart, his little arms and stuff were so black and from the blades, because they would not listen. Our doctors are to be respected. Our caregivers are to be respected. But guys, we know our body. Never be afraid to talk with your doctor. When we did our rare disease day last year, one of the big things that they kept bringing up, doctors kept bringing up, and all the medical students that were there kept bringing up is, we want to know, we want to hear from you. So never be afraid to share with your doctor what's going on, because you know your body. They see you, maybe 2 or 3 times a year, some maybe more, but they see you for that short time. You are with you, or you're with your family member every day. Miranda, you're with your baby boy every day, and you see and you know what he needs, and you know that better. So never be intimidated by doctors and feeling like you just don't have a voice or you don't want to make them mad. And let's see. So I do want to make sure that you guys plug into that video and watch it. And I know I learned a lot of things. Sometimes it's not about just learning. Sometimes we're reminded of things that we already know. It's just been so complicated that we have forgotten that part. So let me share one other ER story with you, and then I'm going to see if anyone else wants to share with the time we have left. And this is actually a diabetic story, but it is it's an advocacy story. And I probably will get emotional, but I'm going to try really hard not to. About 7 years ago, my dad passed away, and my granddaughter had just been diagnosed with type 1 diabetes. She is now 13, going on 14. And let me just say, it is a struggle every day, some days. But my dad passed away, and I was driving to the hospital. And that night when we had to take her, I kind of had that, I was reliving that, okay? I just did this last week with my dad. So we walked in, and the nurse says, okay, we've got 2 or 3 empty rooms. And she starts walking directly toward the room that I had just did a week ago and said goodbye to my dad. I just froze him. I just froze. And I had the baby in my arms, and she just kept saying, Nana, please, can they just give me my fluids? She was great, scary all the way around, okay? And my daughter said, the nurse says, Mom, are you okay? And she said, my grandpa just passed away in that room last week. And she goes, oh, no, we'll find another room. And I was like, no, you're telling me, no, I just need her taken care of. So talking about a huge step to advocate for my granddaughter, and the fact to just say, hey, listen, get it together. It's not about you. And that is so hard sometimes, but that's what I had to do, because I didn't want to wait any longer for her to get taken care of. And so to say it was hard is pretty undescribable. But what I want to say is that I also saw, once I could get this stubborn doctor now this is the story, guys. Her doctor was a Mercy doctor in Northwest Arkansas, one of the greatest endocrinologists that I have ever met. Doctor, all around I have ever met. Amazing man. And he had been helping me all evening. We were texting back and forth and finally said, you're going to have to get her some fluids because that's the only thing that's going to pull her out of this. So we get to the hospital. The doctor does not, tried to offer his information. The doctor refused it, did not want anything to do with me. And I said, okay, doc, if you'll just contact her doctor, he's also a Mercy doctor. And he goes, no, I'm not going to do that. And I was like, okay. So he threw the number away that I gave to him. Well, they'd come in and drawn blood. And she said, they came back in a little bit and said, we need to do a dry gas blood work. And I was like, no. I mean, here we've got a child that's in high ketoacidosis, and I said, no, you've got blood. And the whole time I'm texting my doctor, her doctor, saying, this is what they're saying. He goes, no, they can use the blood that they had. And whenever I refused, I'm going to say they all got really, really mad. Doctor came back in, was very rude and ugly and said, I hear you refuse. I said, there's no reason you can't use the blood work that you've already taken her. Now I'm not putting her through that because I've heard, thank goodness I've never had to have, but I've heard how horrific it is. And I said, no, if you just please call and talk with her doctor, we can give her fluids and we'll be out of here. We sat there for 5 hours and he kept saying, well, I think we're just going to have to send her to Children's. And I said, no, if you're going to send it anywhere, we're going to go to Northwest Arkansas. By this time, I'm about ready to pull her because he was just being stubborn and refusing to contact her doctor. So after that happened, and I'm just sitting there hearing this little girl's voice say, Nana, please just have him give me my fluids, Nana, please. And as I'm giving her shots because they're not doing it, I took it on myself at that point to say, I know what she needs, and I'm not going to stand by and do nothing. And we have all either been there or hopefully won't ever have to be there. So eventually he comes back to the room. And like I said, it was very rude. And he said, I said, could you please just call her doctor? Gave him the number again. So he finally swallowed his pride, went and called her doctor, and immediately came in and started her on IV. Within 30 minutes of being on the IV, after all these hours of laying there, she started getting color back in her face. She could sit up, but rather than going through one bag of the IV fluid, she had to go through two. She had to sit through two. Now, whose fault was that? I look at it and say, if her doctor had not been so strong-willed and just been willing to communicate with another doctor that worked for the same organization. And so that being said, I took a stand that night. It was hard. And, you don't really know what's going to happen, but I think sometimes we don't really think about all of that. Now, let me tell you the positive ending to the story. The doctor walks up to the door and says, oh, wow, she looks better. I said, yes, sir. They've got her started on fluids. And he said, do you think you could give me her doctor's number again? Because he said, I'm just going to tell you, I have never been so impressed. When I called him, I didn't have to give him her last name. I just said, I have Eden here at the emergency room. And he immediately said, get her started on this, 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 and this. And he said, I'm just shocked at how well he knew his patients. Now, see, hopefully, because I was affirmed, I wasn't rude, I wasn't ugly, but I was very affirmed, and I just wasn't backing down. This doctor learned that it's okay to communicate with other doctors. The best care that we can have for anyone is to have a team of doctors that are willing to work together. So that's one of my strong advocacy stories, and it turned out positive. So is there anyone else that wants to take a couple of minutes and share maybe an advocacy story that you've been through where you had to be affirmed? Gosh, y'all don't have to be quiet. You can speak up.
If no one else will go, I'll go.
Okay.
That was really powerful, by the way, Tammy.
Thank you.
Good job. Wow. That sounds a lot like our first diagnosis. Um, we back in August of last year, I had no known hemophilia, and my husband didn't know that he had a bleeding disorder. And my son he hit his cheek with a toy, and it just started swelling up, and then it started turning hard. We called the ER, 911 to be exact, and we told them that we wasn't sure what was going on, that he might have been stung by a bee. It's just swelling up. And so we got there, and we got in a room pretty quickly. They did an ultrasound. They said there was fluid in there, and then they stuck him with an 18 gauge needle in his cheek. And the doctor, it was 7 o'clock whenever we got there, and we finally walked out of the ER with my son at 1 o'clock in the morning, and we drove to Children's with a sheriff behind us because they called DHS on us. It was a mess, an absolute mess. And he got to OU, and he sat there for hours more getting checked out, getting every bone in his body x-rayed. And they never stopped his bleed until about 7 in the morning. He finally, a doctor come and told us that he has a bleeding disorder and that he's going to need factor. And so that's whenever we finally got told what was going on. But we got treated like we were criminals. No one was listening to us. It was absolutely horrible. So I hate going to the ER. I got paperwork now showing, hey, we don't beat our son. He has a bleeding disorder. And it's still, you get looks from people. It's really sad.
Thank you, Miranda. That talking about powerful, yes. And there are so many stories exactly like yours, where parents have lost custody of their children because they thought that they were being abused. So let me say, that was also a passion that's one of the things that we brought into our training. I would always say, never ignore abuse, but please think bleeding disorder, because these babies may bruise and have bruises in places that they shouldn't have. And so the next year I went to an NHF conference, and I'm passing this door, and on the top of the screen it says bleeding disorder or abuse. So you know what? There's work in progress, and your stories are what are so powerful. So we never want to ignore what could be, but we don't want to be careless about what is either. So thank you so much. Jeanette, do you have anything that you want to top us off with tonight before we?
Yes, thank you. Well, first of all, Miranda, I just want you to know, in this space alone, I'm pretty sure you're not alone. And Kristen, I don't mean to speak for you, but I think the very same thing or similar happened with Cameron, right? Did they think you were abusing him?
No, we always said we had that get out of jail free card, but we always had people at Walmart like come up and flip over his medical alert bracelet and stuff like that. But I think I was always sarcastic and be like, no, we don't beat him. He has a bleeding disorder. So, I mean, I just always cut him off at the path, and I'm very vocal anyways. Derek's kind of the laid back one. So I'm very assertive on, what he has, what's going on, and what needs to be done. And we've been lucky in the ER aspect. We've never, I think one ER we had to kind of get not hateful with, but we finally got to the point where we're like, no, you're not sticking him again. This is your last chance. You don't get it. You don't stick him. But we've been pretty lucky, but we've also been either going to Tulsa or OU Medical. So, they kind of knew where we stood. And now, wherever Cameron goes, they're like, oh, it's Cameron. He's weird. He does everything different than everybody else. So.
Good.
And that's okay, because they know he stands out.
I know I've heard that story from several of our community members, though, that they've been misunderstood. So I'm really Miranda, I just want to say again how proud I am of you, because y'all, they were diagnosed right as the pandemic was hitting, and she hasn't
Oh,
even,
bless
they
her.
haven't even been to any of our live functions at all, but have just driven. They have joined our community and just gone full throttle, and even did our recent advocacy days and told this powerful story of hers to her legislators, and boy did they listen. And one of them was kind of embarrassed for his local hospital. So so there. it's good to
Good
be
work.
an advocate. Before I wrap up, Glenn, is there something you wanted to share? I see you're coming off mute, and I want to make sure you're heard.
No, I'm fine. I just I didn't get diagnosed with my bleeding disorder till my early 60s.
Wow.
And one of the things that I growed up out in West Texas where the humidity was 10-12%, but just about on a weekly basis for 60 years, I would have a nosebleed. I didn't think much about it. And anyhow, on the wife being pestering me to go find out why, is when I got diagnosed with this bleeding disorder. And yeah, you wake up in the morning and you got a big old bruise on your arm, and you go, where'd that come from? I tell everybody she beats on me at night, but I don't have anything to add. Thank you very, very much.
You're
Thank
welcome, Glenn. That's exactly how we were diagnosed. My daughter was having nosebleeds, and I said, well, kids have nosebleeds. She plays softball. It's hot. It's dusty. But when they started coming multiple times a day, and she would wake up in the morning and her pillow would be covered in blood, I'm like, I don't think this is normal. So that's actually, the nosebleeds are how we found out with her. So see, I don't know you yet, but we already have things in common. So thank you so much for joining. I hope that you all will join us again. Like I said, we will put the date out there, but right now, if you'll mark your calendars, it's going to be Tuesday, July the 27th, and hopefully nothing will happen to stop Dr. Liz from coming on. But if it does, then I promise you we will have someone else that can share a story or just really bring us back together as a group. And Jeanette, if you could please remind us of our annual meeting.
Yes.
When is that coming up?
Well, actually, let me do one thing first. Glenn, is
Okay.
your last name Hoke or Hawk? I might be saying it wrong.
That's correct.
Okay, just want to make sure. I wanted to make sure you were in our database, and you are. So I'm going to follow up with you later and get you some more information about your particular bleeding disorder. So be awaiting my phone call. We have a mom's group that's coming up soon. I want to make sure all of you know about that, for our mothers in our community, caregivers and affected, doesn't matter. You'll need to register ahead for that to get your materials on time. We will be sending some things out in the mail. So check that out on our website. Annual meeting. Our first live event since the pandemic is going to be July 23rd and 24th in Oklahoma City. Be there. If you live far away, and I think everyone on this call, except for maybe Tamra and myself, will be traveling into the event from wherever you live, and the hotel room is on us. So you'll be seeing registration open for that very soon. Please plan on being there. That is the best place for education and networking and to meet other people like you.
And we want to hopefully find a little time to bring our VWD patients together. Yep. And just kind of share and touch base. So I know Jeanette and Tim are working on trying to get that little time for us. So just reach out to those that you know that that do have VWD, or, we're not just VWD, but we do want to make certain that we are not missing bleeding disorder patients. And sometimes that can happen. So we want to come together. We want to talk about it. What are our needs? What do we need? So I'm going to stop now. Thank you so much for joining us tonight. I look forward to seeing you on upcoming calls, and invite someone to come the next time we have our call. Good evening. I hope you have gotten a little bit of knowledge tonight, or just some reminders, or if nothing else, most important, some encouragement. You guys have a great evening, and we will see you soon.
Thank
Good
you.
night, everyone.
Thank you.
Bye, everyone.